everyone, my name is Jeffrey Pereira, and today I'm here at the San Francisco General Hospital with Dr. Marlene Martin. Dr. Martin is an associate professor of clinical medicine at UCSF and a hospitalist at San Francisco General Hospital. She is also a board certified in internal medicine and addiction medicine. On top of all this, in 2019, she founded and directs the addiction care team. She has deep roots in the Bay Area since she did both her undergraduate and medical training at Stanford, and then her residency and DEI champion training at UCSF. Dr. Martin, I am so happy to have the privilege to meet with you and learn about your story.
Thank you for having me. I'm really excited to be here.
So, I've introduced you a little bit, but I'd like to hear from you. Who are you and what do you do?
Yeah, I'm a doctor at UCSF. I work at San Francisco General Hospital. It's San Francisco's county hospital. I love working here because we get to take care of everyone who walks in through the door. And I love the mission-oriented people who work here. I love that I get to teach residents and students, and that the patient population I get to work with, and the innovation that happens because I'm also at UCSF.
So take me back to your earlier years, from your childhood to studying human biology as an undergrad. What was your upbringing like?
Yeah, good question. I was raised in Los Angeles. I come from an immigrant family. My parents are both from Mexico. They moved here in their teens to the United States, and they were neighbors. That's how they met. And then they had four of us. I'm the oldest of four. No one in my family has been is a doctor, and my parents didn't have the opportunity to go to college. And it's lots of similarities in the immigrant story with getting here and then working really hard and wanting better for your kids. And those are my parents. They still work so hard to this day. I'm so proud of them, and I think everything that I get to do now is because of them. So I grew up in this little Mexico area of LA. I thought the whole world was Catholic and spoke Spanish until fourth grade, I want to say. And then I wanted to be a doctor, I think, as far back as I can remember. And so when I got to high school, I just copied what the other kids were doing when they, to take the PSAT and the SAT and go to college. Then I ended up at Stanford because of some experiences that I had earlier on with a program called Leadership, Education, and Development that took me to UCLA for a summer during high school. And this program allowed me to meet one of the RAs, the resident advisors there, who was a college student at Stanford at the time. He was an econ major. I'd never heard of Stanford. I'd only planned to apply to some of the UCs in California for college. And that's really the reason that I ended up applying to Stanford. And, I got financial aid and was able to attend for undergrad, and just loved the cozy environment there so much that I stayed for medical school.
So when you think back, what is your earliest memory of falling in love with the sciences?
Yeah. I think there's a couple of memories that made me fall in love with science and medicine. Some of it was I was a bookworm when I was little, and I was reading stories about a pediatric oncologist. And it was a series of novels, I think, in fourth grade, and I loved those. And I remember telling my mom that I wanted to be a doctor after that. And then it was just having really wonderful science teachers in high school, a lovely biology teacher who made science fun. And then the intersection of medicine for me is a perfect way to include science, because medicine is about people, it's about the relationships, and it's about having the science impact people's lives. And that's why I love medicine.
So what are the roots of your interest in internal medicine and addiction medicine specifically?
For me, why internal medicine is because of the people. I get to spend so much time talking to patients. Within internal medicine, I practice hospital medicine and addiction medicine. And as a hospitalist, I take care of people who come to our hospital's emergency room and need to stay in the hospital for multiple days to get their care. And And over that time, really, I get to see people every day. I get to listen to them, to their stories, to who they are, to what matters to them, to what caused them to end up with the illness that they have in the hospital. And those are the same reasons that I love addiction medicine. The reason I went into addiction medicine is because as a hospitalist, taking care of patient after patient with complications of addiction, such as bleeding, having heart infections or bone infections, and knowing that I could do everything that I needed to take care of the bleeding, to fix that, to take care of that infection and make it better. But if I didn't address what the patient was actually there for, the whole person, that root cause, which was the addiction, people just ended up coming back again and again. And it was taking care of a couple of people and then realizing that the reason people are using alcohol and drugs and other substances are entrenched in a lot of inequities and social determinants of health. And wanting, as someone who values social justice, really seeing addiction is actually part of somebody's medical care. It's a chronic medical disease, and there are things that we can offer and do something about. So that's what led me to form the addiction care team. And that's a hospital-based team that sees people who have unhealthy alcohol and drug use.
So you've concentrated in STEM disciplines right throughout your academic career. Could you have imagined yourself pursuing a career outside of these sciences?
Yeah, I think I love teaching. I thought about like counseling. So I could have seen myself as a high school teacher or being a counselor in a high school. I love like mentoring people through the application process and reading people's personal statements and things like that. So I think that's something else that I would have considered. And what I feel lucky about now is that I get to do that as part of my job here at UCSF.
If you could name a few, which individuals have had the most valuable impact on the trajectory of your life, and how?
My mom, for sure, just because she inculcated in me and really in me and my siblings a sense of social justice and si se puede, yes you can get there, you can envision it, and education opens up so many doors for you. And having that, I think, throughout my upbringing made me believe that I could do it, and I just kept going. And then there's Dr. Oscar Salvatierra, who was a mentor to me during medical school. He was, at that time, he passed away a couple of years ago, but he was a transplant kidney doctor for kids, and he was involved in creating some of the transplant policies and contributing to that in the United States. And he developed Parkinson's. And when he developed Parkinson's and could no longer operate, he used all of the energy that he had and his passion for doing surgery he used that energy to mentor students. I wasn't even his assigned mentee, and he took me under his wing and really helped me to focus on some of the things that I wanted to do and to make me believe that things are possible. So more of the, I think, yes, you can attitude.
What is a lesson you heard a lot as a child you only truly understood when you experienced it for yourself?
Yeah, one lesson that I think my parents also taught me was you just can't judge a book for its cover. And that I heard again and again in school, and it's so true. I think of this a lot in addiction, a lot in interactions that we have, sometimes difficult interactions, and you just don't know what the other person is living, what's going on in their day-to-day, what they might be suffering, what might be happening to their family. And so just having empathy and having forgiveness, right? Knowing that not everything's going to go okay, and leaving space for people to make mistakes, and for yourself to just have that space for yourself.
In the rawest form, what is it like being a woman with a bicultural Mexican immigrant background in medicine?
I'm so proud of my heritage and what I can offer my patients, and some of the collaborations that I'm able to do, and things that I can influence. And I want to make sure that I use that to help other people who identify as I do, or who have some intersectional identities, be able to know that they can do it too, and to make care better for Latinx individuals.
How have you incorporated other fields into your work, and how do you identify potentially fruitful collaborations?
We do a lot of collaborations in medicine. For example, with the addiction care team, it's a collaboration between doctors, nurse practitioners, nurses, and patient navigators who work to take care of the patient. And then patients also collaborate, right? Because they tell us what they need, and they're the experts in their body, and we listen to them. And not only in terms of patient care, but I think when we're trying to think about systems improvements in the hospital, new workflows, I work in the hospital, right? And so thinking about just how to work beyond the hospital walls to make care better for people after they leave, we have to collaborate with our community partners. When you're doing research, I think research is only enriched by having different perspectives and having multidisciplinary individuals involved in planning the research. It always ends up just more than the sum of its products.
What do you do in your free time?
I like to spend my free time with my friends and family. I value just eating with them, cooking, exercising.
What are opioids?
And binge watching TV. That's what I do like to do.
Okay. What are opioids? Why are they administered in hospitals if they're so addictive? And how did a once small issue turn into an epidemic?
Yeah. Opioids are in the hospital used as medications that can treat pain, and so they're really important to have in the setting of a surgery or some trauma that happened to the body, and you need something that will work very quickly and to address pain. They're not great pain medications in the long term, and they can be addictive. There's different reasons that they may become addictive to people in terms of what people might be treating. And they're also just, even if you're using them as prescribed in the setting when they're prescribed medically, they cause dependence and tolerance. So it means that people may need higher doses to get the same effect over time. So that's just a natural property of opioids. And then the opioid epidemic, we saw in the early 90s, people were dying of prescription drug overdoses. And then we saw that we began to regulate prescribing of opioids as a country, and we saw people switch to using heroin. And then we most recently have seen people turn to synthetic opioids like fentanyl, and that has those opioids like fentanyl are very, very strong, and they have a really high risk for overdose when people are using, especially if people are using substances alone. And at the same time, I go back to what I said, like opioids can be helpful in certain settings where people are experiencing acute pain. And for a lot of people, it's hard now also to get prescription opioids, people who've been using them for a while, who've been on chronic prescription opioids and who have sort of been cut off in the setting of the opioid epidemic. It's been really hard for them to also get the care that they need. So this is a very complex issue that's hard to just disentangle in a couple of minutes, but it's a complex story, and it's not just about opioids, right? We've had people who are dying of alcohol-related complications for decades now, 100,000 people every year. We had a cocaine epidemic in the 80s, right? And we didn't discuss it like we are now. And so we know that currently people are not just dying of opioids, they're dying of multiple substances, with multiple substances in their body sometimes. So we have to look at sort of all all of addiction together.
What is a substance use disorder, and what is the difference between addiction and dependence?
Yeah, I would more so, I think that's a really great question. I would think about this as a spectrum of substance use. And that spectrum includes people, maybe let's use alcohol as an example. People who don't use any alcohol, so they're abstinent, right? Then you have people who maybe use intermittently, use on the weekend socially, so they have intermittent use. Then you have people who are using alcohol in higher quantities. They may have something called at-risk use. And then you have people who are using alcohol, and usually in higher quantities, and they're having negative consequences from use. So it's people who are having the negative consequences from use who are going to have the alcohol use disorder or the substance use disorder, the addiction.
What social and political changes need to be made to tackle the opioid epidemic? And if you were given 1 year to implement any changes, what are the first things you would do?
Oh, so many things. Let me pick a couple to focus on. So one is not just thinking about this as an opioid crisis, but thinking about this as an addiction crisis, and it's not just going to be tackled, right? It's going to remain. I think this is something that we are going to thinking about, that continuum of substance use that I explained before. It's something that continues into people's lives, right, moving forward. And people can move from having an addiction to not having an addiction and back. And so one thought is really expanding the behavioral health workforce who can help care for people with addiction. Right now there's a big focus on addiction specialists, but really we need an all hands on deck approach given the number of people who are affected by addiction. For example, I didn't learn about addiction until I, chose to pursue training after I finished residency. I didn't learn about this in medical school. So I think teaching this in nursing and in medical and social work schools is one thing that I would make sure is happening. And then two, I think changing the narrative about addiction just as a society. I think we impose a lot of stigma and moral judgment on people with substance use disorders. And that narrative, when you learn why people are using and really have empathy and space for those reasons, I think it allows people to see this as something that can be addressed and not something that needs to just be blamed on not something that should be blamed on the individual, and certainly not something that should be punished with some of the in a carceral way like we have done in the past.
What are the biggest misconceptions about addiction?
I think one of the misconceptions is that it's a personal moral failing. Another misconception is that it's not treatable because it's a treatable chronic medical disease.
What do patient complications look like throughout your week? And would you say that patient complications make your job more interesting?
I wouldn't call it necessarily medical complications, just, patients evolve here in the hospital. They come in and they have a chief concern, and over the course of days we get to think about are the diagnoses that we're thinking of from the beginning. Every day we rethink that as new information comes up. We get new laboratory data, or the patient develops new symptoms. And so, some of it is just part of the natural course of the diseases that people present with. And I mean, that's what I love about medicine, that it is challenging, and that the same concern, for example, shortness of breath, can be a heart problem, but it could also be a lung problem. And we get to use our brain and think about those things here in medicine.
What is one moment when you realized you made the right career choice?
I feel that I made the right career choice every time I am interacting with patients. I get to do a lot in my role here in the hospital, including teaching, working administratively, but it's taking care of patients, and that really reinforces why I went into this. And getting a hug from a patient, or just being told thank you for listening to me, and knowing that the care that I provided made a difference for a patient, that is what makes me so happy at the end of the day.
Describe to me a time when you failed in something, but it was only through this failure that you were able to develop into the individual you are today.
Yeah, I'm a pretty persistent person, but I remember getting a C in college in my first OChem class and thinking that medicine was off the table for me. And I took a 1-year break and took econ and other courses. And math, I thought I would, maybe switch to math because I love math. And then I just came back to medicine because I love it so much. And a C in one course that's not the end of the world. There's other courses. It's an average, and just persistence. I guess persistence pays off. And then it also taught me to think about chemistry like math with equations. That's really what it was, and to get help. I wasn't going to some of the office hours and tutoring options that we had, and so I started using all my resources. And then when I did that, then I was able to succeed in those courses.
Describe the most exciting moment and valuable aspect of your medical experience thus far. What keeps you coming back?
I still have to come back to my patients. They come here to the hospital and they need care, and it's a privilege to serve them.
Is there a separation between your career and personal life? When you walk through the door into your home, are patient complications on your mind?
I think I like to think about work-life integration because it's hard. It really is hard to separate. I try to have boundaries and not be thinking about work all the time and setting those up. And what helps me is making sure that I'm spending time with my family and my friends and having activities that I do and social events and looking forward to things. But sometimes you bring stories home, and they weigh on your mind, and it's usually for a good reason. And at the end of the day, it means that I care as a doctor, and that matters to me.
How do you approach addiction care?
Yeah, here in the hospital, I get to, my patients are here. I get to go around the wards, knock on their doors, go inside, introduce myself, sit at their bed, or at least eye level with the patient, ask them how they prefer to be called. I ask for permission to talk about their substance use. I then chat about, the role that substances are having on their lives, what they like about them, what they don't like about them, what sorts of efforts they've tried before to make changes, what has gone well, what hasn't gone well. And then based on what their goals are and what they have tried in the past, we as a team really present a menu of options for people, and then make a plan. And that plan includes linking people to the services that they wanted after they leave the hospital. So it really impacts their lives beyond the hospital. There's three main approaches that I would think about that I feel like I use when I take care of people with substance use disorders. One is just having a lot of empathy and trying to think back to what are the reasons that somebody might be using, what might have led to that use. They don't have to tell me if that's not going to advance their care, but just leaving space for that and really making people with substance use disorders are afraid to come to the hospital because they've been judged and stigmatized and they've had bad healthcare experiences in the past. So I just make sure that the empathy that I'm showing acknowledges what they've been through and makes the hospital a welcome place for them. And then the second part of treatment is offering medication for addiction treatment. So especially for opioid use disorders and for alcohol use disorders, we have some medications that are really underutilized and they work. They help people to meet their substance use goals. And then the third part of treatment is some of the psychosocial or behavioral components of treatment, and presenting that menu to patients so that they can choose what they want.
What advice would you give to the younger generation of up-and-coming scientists?
To believe in yourself, to ask for help, and to take care of yourself along the way.
All right, everyone, this is Dr. Marlene Martin. Thank you so much.